Hello guys, my name is Danish Ashraf, student of B Farm. Today I want to share some points regarding megaloblastic anemia. Before I jump into my topic, I want to tell you guys some things about anemia, so let's get started. Anemia is a disease of blood described as decrease in the total amount of RBCs or hemoglobin in blood, or we can say it is the low ability of carrying oxygen by blood. Now let's take a look regarding types of anemia. There are three types of anemia classified according to the size of RBCs, and the types are microcytic anemia, or we can say the iron deficiency anemia. In this case, the RBC size are smaller than the normal size. After that, we have normocytic anemia. In this, the RBC size is normal, but they are low in number. After that, we have macrocytic anemia. In this, RBC size is much larger than the normal RBC size. Now let's start our main topic, which is megaloblastic anemia. It is a condition in which bone marrow produces usually large, structurally abnormal, immature RBCs. Megaloblastic anemia has several different causes like deficiency of vitamin B12, also referred as cobalamin, deficiency of vitamin B9, also referred as folate. These are the two most common causes of megaloblastic anemia, as these vitamins play an essential role in the production of RBCs. Now, etiology. Vitamin deficiency anemia, or we can say megaloblastic anemia, occurs when the body do not have enough of the vitamin needed to produce adequate number of healthy RBCs. Vitamin deficiency anemia may also develop because body cannot properly absorb the nutrients from the food we eat. Causes of vitamin deficiency anemia, also known as megaloblastic anemia, include folate deficiency, cobalamin deficiency, and vitamin C deficiency. Now let's take a look how these deficiency occur in a human body. First of all, we will talk about vitamin B9 or folate deficiency. A diet consistently lacking in vitamin B9 can lead to deficiency, or certain drugs such as some anti-seizure medication can interfere with absorption of this nutrient. Pregnant and women who are on breastfeeding have increased demand that can result in a deficiency of vitamin B9. Vitamin B12 deficiency or cobalamin deficiency. A diet lacking vitamin B12, which are mainly found in meat, eggs, and milk. If small intestine cannot absorb vitamin B12, this may be due to surgery of stomach or small intestine, abnormal bacterial growth in stomach, or intestinal disease like as Crohn's disease or celiac disease. Vitamin B12 deficiency can also be caused by tapeworms. Vitamin C deficiency. It may develop if we do not get enough vitamin C from food. It is also possible if something impairs our ability to absorb vitamin C from food. For example, smoking. It impairs our body's ability to absorb vitamin C. Now let's take a look towards the risk factors of megaloblastic anemia. Folate deficiency, nutrition deficiency, strict vegan diet, elderly age, alcohol use, narcotics abuse, malignancy, autoimmune disease, and diabetes. Now let's take a look towards the pathogenesis, meaning how the disease imparts in humans or human body. It is because of ineffective erythropoiesis, which means if our body has a deficiency of vitamin B12 and folate, that may cause the production of defective DNA synthesis subsequently, and the nucleus and the cytoplasm do not mature, which can lead to ineffective erythropoiesis, that means less count of RBCs inside the human blood. The symptoms of megaloblastic anemia is fatigue, headache, yellowish skin, irregular heartbeat, chest pain, cold hands, leg cramps, and insomnia. Now let's take a look towards the test and diagnosis of megaloblastic anemia. The doctors diagnose megaloblastic anemia through blood tests that check number and appearance of RBCs. People with the anemia have fewer RBCs than normal. Amount of folate and vitamin B12 and vitamin C in blood. Vitamin B12 and B9 levels are measured at the same time because these deficiencies can cause similar signs and symptoms. Additional tests for vitamin B12 deficiency are antibodies test and Schilling's test. Now let's take a look towards the treatment of megaloblastic anemia. Treatment for megaloblastic anemia includes supplements and change in diet, vitamin B9 or folate deficiency. Treatment involves eating healthy diet and taking folic acid supplements as prescribed by the doctor. In most cases, folic acid supplements are taken orally. Once level of folic increases to normal, patients may be able to stop the supplements. Vitamin B12 deficiency. For milder cases, treatment may involve change in diet and vitamin B12 supplements in pill form or as a nasal spray. Doctor may suggest vitamin B12 injections. In severe case, patient may receive the shot after often as every other day. Eventually, patients will need injection once a month, which may continue for lifetime depending on situations. Vitamin C deficiency treatment for anemia related to vitamin C deficiency, in which vitamin C tablets. Additionally, you increase your intake of food and beverage that contain vitamin C. Now, lifestyle and home remedies that can change your perspective, that can increase your vitamin B12, vitamin B9, and vitamin C to normal. For that, we may use some extra foods like choosing a healthy diet. Food rich in folate includes dark green leafy veggies, nuts, fruits, juices. Food rich in vitamin B12 includes milk, cheese, yogurt, broccoli, citrus fruits and juices, strawberries, tomato. Consider a multivitamin diet and please don't smoke. So